Deliverable 1. Welcome. Welcome to the presentation. Public health is crucial to public safety. This presentation will cover various topics regarding public health, such as the definition and real-world examples of public health, as well as the mission and core functions of public health. This presentation will also identify significant figures that have contributed to public health. Lastly, this presentation will discuss how data contributes to public health. As a result of this presentation, all participants will have a better understanding of public health. Definition and real-world examples. Public health is the science of promoting health, preventing diseases, and prolonging life in human populations through society's organized efforts. Worldwide, local, national, and international public health organizations and governments have established data collection systems that vary depending on local needs, available resources, and infrastructure. Many real-world examples of public health and organizations demonstrate public health. The World Health Organization, or WHO, defines public health as the art and science that combines strategy and tools to promote life and prolong health. The WHO organization works worldwide to promote health, keep the world safe, and serve the vulnerable. The CDC states that public health works to protect and improve the health of communities. The CDC works to protect the United States from health, safety, and security threats, both foreign and in the U.S. Whether diseases start at home or abroad, are chronic or acute, curable or preventable, human error or deliberate attack, the CDC fights disease and supports communities and citizens to do the same. The CDC also works to increase the health security of the United States. As the nation's health protection agency, the CDC saves lives and protects people from health threats. Public health focuses on the prevention of health problems and promotion of healthy behaviors and lifestyles, rather than solely on the treatment of diseases. The field of public health employs a multidisciplinary approach, drawing on knowledge, expertise from various disciplines, such as epidemiology, biostatistics, environmental health, social and behavioral sciences, health policy, and management. Public health. Public health professionals assess and monitor populations' health, identify health risks and determinants, develop and implement interventions and policies to address those risks, and evaluate the effectiveness of public health programs and initiatives. Public health initiatives can cover many areas, including infectious disease control, immunizations, chronic disease prevention, health education and promotion, environmental health and safety, occupational health, emergency preparedness and response, health equity and social justice, and healthcare policy and administration. Overall, public health aims to improve and protect the health and populations, prevent disease and injury, and promote health equity by addressing underlying social, economic, environmental factors that influence health outcomes. Public health works to improve the health and well-being of populations by promoting health behaviors, preventing diseases and injuries, and protecting individuals and communities from health threats. The specific objectives and priorities may vary depending on the context and needs of different populations, but the fundamental mission remains consistent. Now we will take a more in-depth investigation of other crucial aspects of the public health mission. Health promotion and prevention is a crucial point of public health. Public health aims to educate and empower individuals and communities to adopt healthy behaviors and make informed decisions that contribute to overall well-being. This includes promoting healthy lifestyles, including regular physical activity, advocating for healthy eating habits, discouraging tobacco and substance abuse, and promoting sexual and reproductive health. Public health also focuses on preventing diseases and injuries through vaccinations, screenings, and interventions to reduce risk factors. Surveillance and monitoring are crucial missions of public health. Public health professionals gather and analyze data to monitor the health status of populations, identify health trends and emerging health threats, and assess the impact of interventions. This surveillance helps detect outbreaks, track disease spread, identify areas of concern, and inform public health policies and strategies. For example, the CDC tracks various diseases and illnesses, such as the flu, to help prevent and protect the public. Public health works to identify and mitigate environmental and occupational factors that can negatively impact health. This includes monitoring air and water quality, ensuring safe food and sanitation practices, preventing and managing exposure to hazardous substances, and promoting workplace safety and addressing environmental justice issues. The core functions of public health, as identified by the World Health Organization, or the WHO, and widely recognized in the field, are a framework that describes the essential activities and responsibilities of public health agencies. These core functions provide a comprehensive approach to addressing health challenges and improving the well-being of populations. The central core functions of public health are assessment, policy development, and assurance. Policy development can begin with the information gathered by those addressing public health. Policy development involves the process of information sharing, consulting, and citizen participation to decide on public health measures. Law and policy are among the most effective tools to improve health. Real-world examples of health success in the United States result from legal or policy interventions, such as smoke-free air laws and mandatory seatbelt laws. The assessment function involves systematically collecting, analyzing, and interpreting data on the health status of populations, health determinants, and health system performance. It encompasses activities such as monitoring health trends, conducting research, and assessing the needs and assess of communities. Public health agencies can make informed decisions, allocate resources effectively, and develop evidence-based strategies and interventions by understanding a population's health challenges and priorities. Policy development involves the process of information sharing, consulting, and citizen participation to decide on public health measures. Through policy development, support for individuals and community environmental health efforts can be achieved. Assurance involves active pushes to ensure communities are healthy and protected. Public health assurance professionals work Public health assurance professionals work to make health services available to people and their communities. They also ensure that these health services are high quality and easily accessible to community members. Additionally, assurance involves promoting and protecting public health through dedicated programs, events, campaigns, and other strategies to safeguard health and wellness across populations. These core functions work together to create a comprehensive and integrated approach to public health, aiming to improve the health and well-being of populations. Public health professionals, including epidemiologists, health educators, policymakers, and healthcare providers, collaborate to address the diverse health needs of communities and promote health equity. An example of a real-world public health function is an environmental health specialist monitoring water quality at a beach to ensure it is safe for swimmers, surfers, and divers. Humans have long recognized the need to develop systems that can create healthy populations. This has led to many milestones in public health that extend back millennia. Around 500 BCE, ancient Greeks and Romans actively worked to protect the community by taking sanitation measures. The ancient Romans built aqueducts and conductors to carry water from its sources to a central distribution point. Ancient Rome's aqueduct system is an extraordinary feat of engineering, an enormous milestone that brought water to the city from as far as 57 miles away. This helped to protect the public from uncontaminated water. Plagues tore through Europe in the Middle Ages, and as a result, millions of people died. But two essential public health tools emerged: quarantine and isolation. Modern public health emerged primarily from Western European countries, mainly England, France, and Germany. In the 1970s, Congress established a U.S. Marine Hospital Service to deal with the health problems of sick and disabled seamen and created a network of hospitals. John Adams established a national public health policy in 1798 with the Act for the Relief of Sick and Disabled Seamen. That establishment was a critical moment in the history of public health. Progress continued throughout the 19th century as military hospitals were established in key cities, forming the foundation for a national public health system. The 19th century brought the rise of industrialization revolution, which sparked the need for healthier cities. This resulted in a significant milestone in the first public health organization. In 1848, the Public Health Act was established. This was created and operationalized by the General Board of Health in London. This act remedied environmental hazards to health and their localities. This also provided a central board of health and placed responsibilities for sanctions in the hands of boroughs. In 1948, the World Health Organization was developed in France to further international cooperation for improved public health conditions. In 1970, the Nixon administration established the Environmental Protection Agency, which safeguards air, water, and land for the public. The emergence and increase of public health and safety has shown significant milestones in working to protect the world from various diseases and milestones and evolutions, such as the eradication of smallpox. Smallpox was a severe infectious disease caused by the variola virus. It was contagious, meaning it spread from one person to another. People who had smallpox had a fever and a distinctive progressive skin rash. Thanks to the success of a vaccination and public health milestones, smallpox was eradicated. and no cases of naturally occurring smallpox have occurred since 1977. The last natural smallpox outbreak in the United States occurred in 1949. Polio, or poliomyelitis, is a disabling and life-threatening disease caused by the polio virus. The virus spreads from person to person and can infect a person's spinal cord, causing paralysis, where a person cannot move parts of the body. Polio was once one of the most feared diseases in the United States. Thanks to public health and vaccination advancements, wild poliovirus has been eliminated in the United States. A vaccination effort worldwide has led to only a few cases occurring worldwide in recent years. However, polio still spreads within areas with low vaccination rates. Public health has been shaped and evolved by many historical and contemporary figures who have significantly contributed to the field. These individuals have drastically improved public health for the world. These individuals date back hundreds of years and trace to the present. Hippocrates is regarded as the father of Western medicine. Born around 460 BCE, he systematized medical treatments, disentangling them from religion and superstition. He trained physicians in his methods, and with his followers was responsible for authoring a large body of medical textbooks. Sir Edwin Chadwick was a social reformer in the 1800s. He is most well known for his advocating for improving living conditions to improve public health. This was done by stressing the need to provide clean water and remove waste and toxic substances from drinking water. Alice Hamilton is another important figure in public health. She was the first female faculty member at Harvard Medical School and did studies for the state of Illinois, the federal government, and the League of Nations. By actively publicizing the danger to workers' health from industrial toxic substances such as lead and mercury, she contributed to the passage of workers' compensation laws and the development of safer working conditions. John Snow was an English professor known for his studies of cholera and widely viewed as the father of epidemiology. His best known studies includes his investigation of London's Broad Street pump outbreak, which occurred in 1854, and his grand experiment comparing waterborne cholera cases in two regions of the city, one receiving sewage-contaminated water and this other receiving relatively clean water. Snow's innovative reasoning and approach to controlling this deadly disease remained valid and exemplary for epidemiologists worldwide. James Lind, also known as the father of naval hygiene in England, was a British naval surgeon from the 18th century who worked to treat scurvy. In 1795, Lind discovered that citrus fruits, as part of a dietary practice, led to the disappearance of scurvy. There are a great many more significant figures that have contributed to the advancement of public health throughout time. However, it would take a presentation on its own to go through all of these contributors. Use of data. Data is crucial in public health, providing valuable insights and contributing to evidence-based decision-making and interventions. Advancements in information technology and data science have provided innovative tools and data sources for public health. Data is essential for disease surveillance and monitoring efforts. Through systematic data collection, analysis, and reporting, public health agencies can track the occurrence and spread of diseases, identify outbreaks, and monitor trends over time. By utilizing surveillance data, patterns can be detected, risk factors can be determined, and public health responses can be guided. This information also enables early detection and response to potential health threats, such as infectious disease outbreaks or emergency public health crises. Data is also the foundation for epidemiological studies and research in public health. By collecting and analyzing data on health outcomes, risk factors, and exposures, researchers can investigate the causes of diseases, evaluate interventions and policies, and identify strategies for prevention and control. Data-driven research helps advance scientific knowledge, improve understanding of disease patterns and trends, and inform evidence-based public health practices. Another role of data in public health is program planning and evaluation. Before implementing interventions, data is used to identify target populations, assess baseline conditions, and set measurable objectives. During program implementation, data is collected to monitor progress, evaluate outcomes, and make necessary adjustments to increase public health. Using data for planning and evaluation ensures that interventions are evidence-based, effective, and responsive to the population's needs. Data informs health policy development and decision-making processes. Policymakers rely on data to understand population health trends, assess the impact of policies, and evaluate the effectiveness of interventions. Data on health outcomes, costs, and health system performance help identify priorities, set policy goals, and allocate resources efficiently. Evidence-based policy making supported by data ensures that decisions are made on scientific evidence and are more likely to achieve desired health outcomes. Modern day public health emerges from the experience of history and the sharing of data. Organized activity to prevent diseases and promote health had to be relearned from the ancient and post-industrial revolution worlds. The evolution of technology has increased access to data sources and information sharing that can be utilized to improve public health. Data sources such as electronic health records, health information exchanges, vital records, and immunization information systems can all be used to provide essential data about specific population health needs and work to develop effective interventions. Epidemiological data is another source crucial to preventing public health and safety. Conclusion. Public health is essential for all people. This presentation covered key public health facts such as mission and core functions. It provided real-world examples of public health organizations and how public health is utilized. Public health has a long history. Many milestones have happened throughout its long timeline. Some of the notable accomplishments, the significant figures that were part of these accomplishments were also discussed in this presentation. The importance of data and how it is a contributing factor in public health was covered as well. As a result, this presentation should have provided a clear understanding of public health. Thank you for attending.